Hi everyone, my name is Warren Tews and I will be presenting on motivational interviewing for case number 1. I hope that you enjoy. Okay, so if you aren't familiar with this case study, please just take a moment to pause the video and have a read through. I'm going to start off with the ethical issues surrounding this case. So, of course, I will be certain to have the client sign a consent form and be sure that they're aware of their rights in terms of confidentiality and the limits to confidentiality. We're going to want to make sure that they are consulting with a doctor for further infertility treatment and being made aware of all of their options from a medical standpoint. It's also incredibly important to know the scope of my practice. I'm not here to solve medical issues or dispense medical advice, as I'm not an expert in that field. In terms of diversity issues, I think it's important to recognize the dynamics between male-female interaction. So fertility and having children is something that can be very personal for women, and they may feel more comfortable divulging, sharing with another female, with a female therapist. As a male, I understand that I might not be the most suitable therapist for Rebecca, and it's possible that a female therapist might be a better fit. However, due to her aversion to women that has arisen from the potential inability to conceive, it's also possible that she may prefer a male therapist and that she and I would be a good fit. Either way, I think it's important to be cognizant of these diversity factors, and I would be sure to consult with Rebecca on how she feels about both scenarios. If it did turn out that she would be more comfortable with a female therapist, I would be willing to refer her out to someone more suitable. We're going to move on to the major issues in this case conceptualization. The first is clearly going to be the infertility. The medical side of this, as mentioned, is outside of the scope of my expertise. However, it may be necessary to collaborate with the attending doctors in order to facilitate the best treatment possible. We likely will need to be informed of any developments in the course of the medical treatment, just so that we have a full understanding of the implications of said developments and what effect those revelations may have on Rebecca's mental state and the interpersonal dynamics of the marriage. Next, we have sort of a cluster of irritability, marriage infighting. Rebecca's behavior has clearly changed, and it's likely the result of her potentially not being able to conceive. She seems to be lashing out at Jack, pushing him away, self-destructive. There's some negative self-concept. It appears that the revelation of her infertility issues has had a major impact on her self-concept, and that's evidenced by her statements about how she's the problem in the marriage, she's barely a woman, and Jack should leave her and find someone else. Next, we have the issue of avoiding women and children. So this may be a protective mechanism from potential reminders of her medical condition and the psychological distress that comes with it. And finally, we have what may be the most suitable problem for motivational interviewing, as it was developed primarily for patients with substance abuse disorders. Rebecca has gone from drinking in social situations to consuming 1 to 2 glasses of wine per day, which may be a coping mechanism for her distress and deserves further exploration. So we have a couple of different components of motivational interviewing. The first is a technical component, which centers around eliciting patient speech that favors change and helping to reduce talk that argues against change, which is referred to as sustained talk. We also have a relational component, which just means we want to remain patient-centered, and it's of the utmost importance to create a strong therapeutic alliance. We have 4 components of motivational interviewing. So we have engaging, which is connecting with the patient and establishing a therapeutic alliance. There's focusing, which is choosing a direction for the motivational enhancement. Evoking, which is eliciting the patient's own motivations and commitments for change. And finally, planning, which is where we formulate a specific plan. Creating a therapeutic alliance is extremely important, particularly in motivational interviewing. So we want to embolden an atmosphere of collaboration, acceptance, compassion. We want to embody the MI spirit, as they call it, which is non-judgmental and collaborative in nature. It conveys respect, acceptance, maintains a compassionate and motivationally evocative stance. The stage is absolutely critical. It can't be understated, especially for someone in Rebecca's position. Her presenting issues are no small task, and because there is a biological component, there's a heavy element of uncertainty that will likely stem from a lack of control in the situation. So very much in the way that we saw Dr. Steve Martino work, that's the gentleman in the videos that accompany our textbook for the motivational interview chapter. I would want to spend the initial sessions in a dialogue that's centered on creating rapport, emboldening a therapeutic alliance, and developing trust. This will also allow me to ascertain how motivated Rebecca is to make changes, which will dictate the further course of treatment. I would use unconditional positive regard and genuine empathy with the patient. I would ask many open-ended questions to gain a full understanding of her feelings and emotional state. And without trust and an overarching view of her cognitions and her rationale for her feelings, it's going to be exceedingly difficult to create the best possible environment for treating her presenting issues. Here we have some examples of open-ended questions that I would specifically use in this case. And I'm just going to read them out. So to Rebecca, I would say, what brings you in for therapy? How is it that I may be able to help you? When you say you're having more fights with Jack, what are the nature of these arguments? Where's the conflict stemming from? What kind of feelings come up for you when you see other women and children? What is it about the drinking that you feel is useful to you? Since your diagnosis, how has your self-concept changed? How do you feel about yourself? Where are these feelings coming from? This is very much a critical juncture in the relational component of motivational interviewing, and it sets the stage for further sessions and treatment. Additionally, I would employ reflective listening skills, so I would use simple reflective statements that summarize what Rebecca is saying to me without imparting or engendering any added meaning. So what you're saying is, when you see other women with their children, it's like opening up a wound that not only hurts, but it makes you angry because you feel that's so terribly unfair. The drinking allows you to calm your nerves and this pervasive anxiety about potentially not being able to have your own children. This technique it's used to show that I'm actively listening and understanding her point of view and the things she's saying to me. Further on into treatment, I would likely use more complex reflective statements that summarize wider conceptualizations of what Rebecca's communicating. Here's an example. So Rebecca, what I hear you saying is that you're in something of a vicious cycle. You feel deep resentment towards your situation. This resentment builds, especially after you've had a few glasses of wine, and when you can no longer turn it inward on yourself, you take it out on Jack by starting arguments about things that don't even really bother you that much. And you're saying that the source of the arguments is you projecting your anger and resentment towards the situation onto your husband, which you admit is not fair to him. Have I got that right? Next up, we have agenda mapping. So in this phase, the therapist works in collaboration with the client to prioritize which issues are most pertinent. I would want to work with Rebecca and collaborate on which areas of her difficulties are most distressing and require a priority and attention. I would get Rebecca to write down each of the problems, and then after some consideration on her part, I would ask, where do you want to start? Like, what would you like to focus on? In a situation where there may be uncertainty on her part in terms of where she wants to begin, I think that it's important to incorporate a sense of which issues are most easily treated first, so that we aren't taking on too much. For example, in this case, it might be easier to address drinking as a coping mechanism and working to replace it with a healthier strategy than it would be to dive immediately into trying to solve the complexities of her negative self-affect resulting from a medical condition in an ongoing process. I think that many of us would probably agree that this is the most distressing issue for Rebecca, the infertility and the negative self-concept that's stemming from it. But that may be too large of an issue to tackle in the onset of therapy. So discussing it is absolutely necessary. Discussing that issue is necessary, but in terms of solutions, we may want to address some of the smaller scale problems first and work our way up. That's going to bring us to change talk versus sustain talk, which is a cornerstone of motivational interviewing. We want to embody and encourage change talk, and then we want to diminish or reduce sustain talk. From the case conceptualization, it does appear that Rebecca is very much entrenched in sustain talk. There's a negativity that kind of oozes out of that description. And there's some heavily self-limiting, self-destructive cognitions that are affecting both her relationship with herself and with her husband. I think it will take some serious time to establish a therapeutic relationship that allows for some productive change talk to come out and subsequently be encouraged. I would be less likely to discourage the negative sustain talk until a very strong foundation between myself as a therapist and Rebecca as the client has been established. Once we did get to the stage where there are discernible delineations between sustain talk and change talk, I would use affirmations to help encourage the change talk. So here's another example. Rebecca, I think it's really brave and self-reflective of you to acknowledge that you were taking your frustrations out on Jack and that it's not fair to him. You've stated that he's a wonderful partner and that he doesn't deserve to be treated that way. You've done some serious soul searching here, and the fact that you're willing to consider cutting down on the drinking in an attempt to reduce the arguments and be more loving towards your husband is beautiful. And I just want to tell you how proud I am of you for verbalizing it. I know it's difficult, but you've done it now, and many times putting these things into words is the first real step to making a positive change for the better. While there are many potential solutions to this case, motivational interviewing has a very participatory component on the part of the client. It's likely at some point in the therapy we would explore Rebecca's feelings on adoption, in vitro fertilization. We may even perhaps incorporate other therapeutic modalities like CBT to see if we can aid in altering these limiting beliefs around her identity as a woman and as a marriage partner, resulting from her potential inability to conceive. MI is built for addressing substance use issues, which is well suited to Rebecca's drinking. We may even consider involving Jack in couples therapy sessions. However, we want to arrive at these discussions in a natural way and not fall into a couple of traps that are pointed out by motivational interviewing. So we don't want to fall into the expert trap or the premature focus trap. We don't want to communicate that we feel we have all the answers and we're going to solve the problem, especially before a strong therapeutic alliance has been established. That concludes my presentation on motivational interviewing. I hope you enjoyed it. I'm excited to see everybody else's work and for the discussion forums. Thank you for taking the time to view my presentation. Have a great day.